Multiple x-rays. I did multiple x-rays, and now it's yelling at me. How's your arm? Looks pretty bad. Oops, he's dead.
I heard they took that robbery victim from you. That you didn't do such a good job on him. That makes us medics look really bad.
Sorry.
Do me a favor. Be more careful next time.
You got it, Chief.
Tell me, Doctor, are you fitting in here?
I think so. What do you think? Did I sponge the arm? I was about to.
Doctor, did this patient present signs of heart trouble? Then why the 12-lead EKG?
He was dying.
I know we don't want to aggravate a patient's condition, but confirming and locating pain are vital to a proper diagnosis.
Got it.
X-rays are costly, Doctor, and in this case, not required. Not only is a CT scan an expensive procedure, but it can also be frightening for the patient. Order them only when necessary.
I've done
With
everything
trauma like
wrong.
that presented here, I can't believe you overlooked X-rays. Way to identify the break and use
don't
the
think I
splint
did.
to immobilize it. The treatment indicated was not necessary.
Oops.
The treatments indicated were not necessary.
Well,
You apparently
was hungry.
ignored this patient's condition. You needed to alleviate the pain, and an injection by med syringe was in line. Your discharge orders were incomplete.
That's because you took him away. It's the only hospital in America that actually cares about overcost. I don't even get points for these.
This case was difficult, to say the least. Given the circumstances, I can see how you went wrong. But that doesn't change the fact that you failed to draw the correct conclusion.
Sorry.
While this patient's case was not critical, I expect a higher standard of care from you.
He fell off a stage. X-raying his back wasn't a bad idea. Oh, maybe if I did it twice. That's... Okay.
I've been looking forward to reviewing this case with you. Let's see how well you distanced your emotions from your exam and treatment. I can't believe the RR on this
I let them
patient.
both die. What do you think?
I found this patient's BP particularly telling. You did too. Good work. This
That's the
patient's
BP of a
temperature was
criminal.
an important indicator you overlooked.
Was it?
Doctor, we all wear a stethoscope around our neck for a reason.
Is it because it's
damn
useful? It is, isn't it?
Especially in a case like this one. Doctor, we all wear a stethoscope around our neck for a reason.
I gotta get one case
It's
right.
damn useful. Especially in a case like this one. With such evident signs of distress, the 12-lead EKG should have been a top priority. Often the mouth offers important insight into any possible infection. A very nasty break. Use of the portable X-ray would have shown you a collapsed lung. Rather an important detail to note, wouldn't you say?
I was trying to use it.
I'm curious how you can ignore a CT scan in this case, Doctor.
I don't know.
I'm curious how you can ignore an X-ray in this case.
Because I'm an idiot. Is that what you want?
I'm curious how you can ignore an
'Cause-
X-ray in this
no.
case, Doctor. Sharp eyes, Doctor. This patient's weak state
Really
demanded
curious, aren't
the
you?
introduction of intravenous fluids. Good. You injected antibiotics to help the patient's immune system battle the infection. The endotracheal tube protocol was required, and you followed through like a veteran.
I
Way
did.
to identify the break and use the splint to immobilize it. The
Forgot to
treatment
cover it.
indicated was not necessary.
What treatment?
The treatments indicated were not necessary. The treatment indicated was not necessary. The treatment indicated was not
Do you just want me to put the
necessary.
cast on
treatment
top of the
indicated was
wound?
not necessary. The treatment indicated was not necessary.
What?
In cases of such dire pulmonary distress,
You just
chest
want that to
tube
go on
protocol
top of
was
the bleeding
required.
wound?
You failed to use the cold compress.
Oh,
The
put the
patient's
cold
pain and
compress on the
swelling
guy's
could have
leg,
been
which is
alleviated
splitting
by it.
open.
Before you treat the wound, it's important to cleanse the area. Or have you forgotten that small detail? Your hospital orders list is incomplete.
Well, blame the guy who took it from me.
Often our intuition can mislead us. You made the wrong diagnosis for this patient, and it cost a life.
Well, he was a criminal.
Your ineffective use of the tools and time you had
He
at
was
your
gonna
disposal
fry
nearly
anyway.
cost this patient's life.
Oops.
Electrical shock case, and a critical one. We'll step through this one carefully.
Okay.
Talk about through the roof. You put the EKG to good use in this instance.
I thought the EKG was 0 because he
we all wear a
died.
stethoscope around our neck for a reason.
It's damn useful.
Especially in a case like this one. With such evident signs of distress, the 12-lead EKG should have been a top priority.
Oops.
We offer the portable X-ray machine to provide emergency item imaging. It's not a toy.
Emergency
and it shouldn't
what?
be abused like this. Signs of wheezing,
Oh, that's a
labored
giant
breathing, or
tongue.
rapid breaths need attention. You helped the patient by administering
what are you
oxygen
saying?
via mask. The right decision. You handled the crash cart to defib the patient like a pro. Sharp eyes, doctor. This patient's weak state demanded the introduction of intravenous
That's a really
fluids.
blurry tube of
To
IV stuff.
properly address and treat the patient's pain, I see you opted for the med syringe. Good choice.
Thanks.
To properly address and treat the patient's pain, I see you opted for the med syringe. Good choice.
Thanks.
You correctly applied topical medication. You needed to bandage the wound,
What wound?
doctor. Fractures must be immobilized, doctor.
With what,
the
gauze?
splint should have been used.
That's not a
Before
splint.
you treat the wound, it's important to cleanse the area. Or have you forgotten that small detail? Doctor, you forgot to apply topical medication.
You're skipping.
You signed the patient into the hospital, but failed to list a comprehensive plan for hospital care. Be more careful next time.
Oh, he didn't die.
Do you think this patient's life is a multiple choice exam?
Actually, kind of. I just check off stuff on a list. Well, I think everything at the hospital's going perfectly well. Gotta go chill in the lounge. Get me some JPEG coffee. Oh. Are you my next patient?
You want a pretzel?
Nah, I'm good.
No?
Trying to quit.
I'm on a personal slowdown. I am so sick of administration coming down how to take care of patients. Most of them haven't worked the floor in years.
You tell her, sister.
I've been trying to talk the other nurses into getting unionized. Oh, forget about it. Bunch of scaredy cats.
I'll join.
Sure you don't want one?
Let's have a pretzel union. No. Don't be a bad case. Don't be a bad case. Oh, she looks fine.
Oh, good, the doctor's here. Don't embarrass me, please.
Mom,
She
I'm pregnant.
woke me up
Duh.
screaming.
I wasn't screaming.
The pain was horrible.
You are the one screaming.
Will you tell the doctor how you feel? They have plenty of other patients to see.
What do you think I've been trying to do?
All right,
I
the
feel
pain
pregnant.
started at her belly button, and then it moved much lower, and then she complained of nausea, and then... Oh, my God. What if she's pregnant?
Oh, Mom!
If I find out you had sex with Anthony Scapello,
We haven't even hardly had sex.
hardly, how do you hardly have sex?
Oh, I had a little sex.
If you're always showing up wherever we go.
Will you deal with her, doctor?
Do I have permission to use the defib?
My boyfriend and I agreed to wait till we're older before sex. 16? Maybe
don't-
17.
I don't know about that.
I'm burning up.
Are you? I got this. Sounds like IV time.
There's nothing in here that'll get me stoned, right?
Yep. Wait, where? I can't
My
put
mom
the.
thinks she knows me, but she doesn't.
I can't put the IV in. Weird. We put terrible, terrible hallucinogens in your IV. Oral meds? Yeah, why not? Yum. No, that was a bad choice.
It's like a knife. Or needles.
Oh, I have both of those. Do you need an oxygen mask? Here you go. Use of oxygen when not needed is wasteful. Well, everyone's gotta breathe. P test. Alright. Here you go. Negative pregnancy test. Huh. So she's not pregnant after all. Well, in that case... That didn't do anything, did it? I don't know. I don't know what a CT scan would do. Can I check your belly? Beep, beep. Pain, tender, pain upon, pressure, tension upon, palpitation. Okay. I'm going to use the stethoscope because it is damn useful, as I've been scolded at. Lungs clear. I'm gonna use it again. Tongue depressor. Just slip it through the mask. Throat clear. So every time I use the stethoscope, it tells me I don't need it, but every time I don't, it says I wrecked it. I gave her oral meds because I thought it would take the pain away, but perhaps not. Medicine syringe? Yeah, let's go with that. Boop. Whoops, I missed. Medicine administered. Do a CT scan on her abdomen. You got it. I don't know what it's supposed to look like. CT scan taken. It's unnecessary. Ultrasound. That's a good point. I forgot I had that. You're not a baby. Oops.
No, you won't, honey. Don't worry, sweetie, okay? It's going to be fine.
They took her away.
I'll be right here for you. Oh, just 1 second. I'll be right there, sweetheart.
Your daughter's pregnant.
Look, I know that appendicitis isn't all that uncommon in kids, but that's still no reason for you to be so lax in your treatment of my daughter. Honestly.
Oh. Well, that wasn't so bad. She didn't yell at me that much. I couldn't even hear what she said the problem was, but... Appendicitis. Oh. Oops. Oh, there's somebody dying, isn't there?
Yucklovich, unrestrained driver in a head-on car versus concrete wall.
That's killing me.
Doctor's gonna fix you right up.
Where's Lisa? Is she okay?
I'm not gonna fix you up,
Complaint
actually.
of neck pain and pain to the left side of the chest and the right arm. 2 cm lat to his left forehead. He doesn't remember the event, but denies losing consciousness. It's in pretty good shape considering. The vehicle has severe PSI.
Will someone tell me how Lisa's doing?
The Lisa he's referring to is DOA.
Oh. Is that because I
Lisa and
treated
I-
her?
We're to be married next month.
That's... not terribly good, is it? Oh. No bone tenderness. Well, I wasn't checking for that. It's a giant hole in your face. Let me just sponge your face up. There you go.
I think you're onto something there, Doc.
Thanks. Topical medication. Bloop. I can't believe it's not
Just
butter.
started college.
Where
Lisa's going to
is
join me when she graduates.
suture stuff? I wish I had anesthetic, but nope. I tried. Oh god. Oops. Let's just fix that back. There we go.
Looked pretty grim for a while there, didn't it?
Bandage. Compress. Gauze. Bandage. Bloop. Okay. Yes, I saved the eyebrow. Probably CT scan wouldn't be a bad idea. No evidence of brain injury. Yep, or not neck splint, a neck brace is probably a good plan. Cervical collar. IV probably is also in order in here somewhere. There it is. Boop. Okay. Here's some medicine for the pain, which I'm assuming you have. Now you're not going to feel your thumb. Oh. Oh yeah, it is damn useful. I should use the stethoscope. Oh god. Someone really blurred your chest out. I didn't want your back. No, I want your front. No evidence of lung or heart injury.